Hi, I'm Enchanting Nubianette. Welcome back. And if you're new to my channel, welcome. So everyone, healthcare premiums in the United States are set to soar as subsidies expire. Congress is fighting over whether to extend them. Meanwhile, the U.S. government has been working on a $40 billion aid package for Argentina's financial crisis. And federal workers are caught in the longest shutdown in history. They actually just lifted a shutdown, but they're still waiting on delayed paychecks. So let me break it down for your YouTube family. The Affordable Care Act subsidies are expiring at the end of this year. Without them, premiums could more than double for millions of us Americans. For example, one woman in Wisconsin said her plan will jump from $372 a month to $1,163.50 per month. Oh my goodness, jaw dropping. Medicare premiums are also climbing. Part B coverage is expected to rise from $185 to a whopping $206 in 2026. So this hits all seniors, the elderly, so hard. People who are not able to work. How are they able to afford to do this to these people who cannot produce more income? So experts warn that this is the most chaotic open enrollment since the ACA began, with many families facing a lot more shock.
More of your paycheck is likely to go towards your health insurance premiums next year. Healthcare costs are rising faster than wage growth, and the trend is directly impacting how employers are approaching their sponsored healthcare plans for employees.
It's going to vary a lot from employer to employer and plan to plan, but in general, we're talking 6.5%.
Suneet Patel is the chief actuary of U.S. Health at Mercer. That 6.5% is relative to wage growth, which is averaging 3%. That means more of your income will go towards healthcare expenditures.
People with a single income have a lot less wiggle room, so to speak. I think people with kids will be really affected because obviously their kids are insured with them.
For employers sponsoring health plans, it's a much bigger increase than expected. The biggest increase in 15 years, according to Mercer.
About 60% of employers are planning not only to increase payroll contributions, but increasing cost sharing. So that could be copays, deductibles, co-insurances, or out-of-pocket maximums.
Patel said employers made a significant effort in recent years during the pandemic to absorb those costs. But now changes in the larger economy have altered the equation.
I think the cost pressures are more significant. And even though there is a focus on employee health and well-being, there's certainly just a financial reality.
Be able to afford to do this to these people who cannot produce more income. So experts warn that this is the most chaotic open enrollment since the ACA began, with many families facing a lot more shock. Let's talk about this $40 billion for Argentina. So the U.S. has been working on a $40 billion financial assistance package for Argentina, as I mentioned a few seconds ago. It's split between a $20 billion Treasury currency swap line and another $20 billion from private banks and sovereign funds. The goal is to stabilize Argentina's collapsing currency under President Javier Milei, who is a Trump ally. So yes, that money is about Argentina's economic survival, not the U.S. healthcare, not the U.S. survival, where we know we have so many areas where that money could benefit our people here in the United States. Thinking about this, remember the 43-day government shutdown just ended. So remember that more than 1.4 million federal employees went weeks without pay, suffering Some people will get back pay as soon as Sunday, but others will still have to wait until November 19th, next week. TSA agents, air traffic controllers, and countless other people work without pay while furloughed workers are still scrambling to cover their bills. The necessities: rent, mortgage, electricity, heat, water bills, for example, food, gas, or if you take mass transportation, all of these necessities.
There is inflation, an aging population that uses more health care and better treatments with higher price tags.
Innovations have allowed treatment for diseases that did not experience any treatment options. You can think, for example, of like GLP-1 drugs, such as Wegovy, that are obviously treating important diseases.
Mercer's projections put 2026 as the fourth consecutive year of rising healthcare costs following a decade of moderate increases. The Kaiser Family Foundation annual report last year found coverage costs rose about 24% between 2019 and 2024, but wage growth matched the increases at 28%. It's not all bad news for workers. Employers are paying more for mental health care options. Mercer's survey found access to mental health care benefits ranked third in employers' list of priorities. Access includes resources inside and outside of the health care plans.
The necessities: rent, mortgage, electricity, heat, water bills, for example, food, gas, or if you take mass transportation, all of these necessities. So I'm going to say it again. Folks are out here trying to figure out how to pay $1,100 a month for health care when last year it was only $372. That's not insurance, that's rent or rent money. Or even mortgage if you live in some areas like maybe the Midwest or deep in the South. So this is coming very quickly, everyone. We're approaching near the end of November, and this is a huge, drastic change that people may have to prepare for. And I don't know if they can even prepare for it. And while we're sweating over premiums, Uncle Sam is wiring $40 billion down to Argentina like it's Western Union. Of course, the Argentinian government will, ask and want that help. Of course they're going to have their hand out if they can get it. That's why they network with, another country who can help them. But meanwhile, our federal workers, they had to persevere through the longest shutdown in U.S. history. 43 days with no paycheck, and you're still showing up to keep the plane flying and the food stamps flowing and all the other areas that's needed for the American people. Congress kept getting paid, but the workers, they're waiting until next week just to see their money, some of them. That's like telling someone your check is in the mail while the mailman is on strike. Doesn't make sense. So I have to just put this humor in because there's times we have to laugh to keep from crying. But the truth is this: healthcare costs are crushing families. They have been for a long time. Many people, even before, the 2020 crisis, but especially even afterwards, there's people who have gotten a huge bill and it caused them to become homeless. It caused them to lose their car. It caused them not to be able to pay their rent or mortgage because of this heavy debt. You have a small procedure and it's cost over $1,000 or thousands of dollars. It brings a huge setback. and there's no way to get around
Some
it.
Floridians could be paying hundreds of dollars more for health insurance next year.
The Trump administration published the prices for Affordable Care Act plans as the government stays shut down while lawmakers fight over subsidies that would make the plans cheaper. Channel 9's Nick Papantona has compiled all those prices, and Nick, millions of people in the state use those plans.
4.7 million, and this is what we want to show you right here. A 35-year-old paying full price next year, which they would pay full price at about the average salary, would be paying at least $400 per month for health care. And if you want a lower deductible, it's even more. The numbers get up as you get older. As Democrats continue to dig their heels in over the Affordable Care Act, the Trump administration publishing the prices Floridians would pay for their monthly premiums without subsidies that expire at the end of the year. A 35-year-old single woman making an average salary of $70,000 in Orange County now spends less than $400 for the full-priced plan. In 2026, that same woman will pay $90 more per month. And the numbers for that $70,000 salary are not much better for the rest of Central Florida, with Brevard County millennials paying the least and Marion County paying the most, 25% more than last year. It's even worse for older Floridians, with a bare-bones plan costing a single 55-year-old making $70,000 in Orange County nearly $900 per month. Until now, that 55-year-old could rely on those subsidies. This year, that same basic plan, the Bronze Plan, costs her less than $300 per month. The new price is more than a dime out of every dollar she makes. But with both parties dug in, Floridians may not know what the cost to them will really be until after the sign-up window ends. Subsidies will still exist for lower income people, but fewer of those people will qualify for less money.
People, even before, the 2020 crisis, but especially even afterwards, there's people who have gotten a huge bill and it caused them to become homeless. It caused them to lose their car. It caused them not to be able to pay their rent or mortgage because of this heavy debt. You have a small procedure and it's cost over $1,000 or thousands of dollars. It brings a huge setback and there's no way to get around it. International aid is flowing overseas. It's uncalled for during this time. Yes, for example, if there's a natural disaster like what happened in Jamaica, you can give some aid. However, don't try to give the taxpayers' money in abundance to another country. Horrible. And our own workers are treated like afterthoughts. That should not be. Every single day, especially if you're living in a major city, we see, people who are homeless, people who have mental issues, walking around. They need to have medication. They need to have housing and food. We have so many children in the foster care system. This has been for decades. Babies who don't have their parents. Maybe their parent passed away. Maybe their parent are too sick. Maybe they were abandoned. But we have all of these crises. We have a drug crisis in America as well. So many ways that we can utilize that money. People who need medical care that do not deserve to be denied. People who need this help and this money that we have, and it should not be going overseas in abundance like this. $40 billion, not even million. Even 40 million would be horrific. Billion, too much, it's extreme. So the compassion means we don't just shake our heads, we need to demand better. Because whether you're in New York, Atlanta, Detroit, DC, Los Angeles, people deserve affordable health care and also a paycheck that shows up on time. Not just wandering, not just in the clouds, not in theory. They need to have that paycheck ASAP. That should be priority mail at this point. It's ridiculous. The bottom line, YouTube family, is premiums are rising. I don't know the exact definitive amount, but they are rising. Argentina They're able to have that bailout. And federal workers are still waiting on their money that they earned, money that they woke up out of their bed, their warm homes, got ready to go to work, and knowing that they were not able to get paid. 43 days. This is horrific. It's not funny. What are your thoughts on this, YouTube family? And are you a person who is going to be affected by these healthcare changes? Please leave a comment below. I'm just really disappointed, extremely disappointed. So everyone, please like, share, and subscribe to my channel. Thank you for watching. Once again, stay safe, keep your head on a swivel.